I'm Dr. Anthony Montoya, and I'm here today to talk about Menieres. There's a lot of misconceptions about Menieres and not a lot of help for people with Menieres. And what is Menieres? Menieres is vertigo, where someone will have a vertigo attack or an episode, but before they have an attack, there is fullness in the ear. And that fullness, ENTs and medical doctors and neurologists think that it's fullness, which is fluid, so they'll prescribe a diuretic, recommend a low sodium diet, which I agree with, but I don't agree with the diuretic. I don't think it's fluid, I think it's inflammation. So what happens is that when that first cervical vertebrae in the upper neck area is jarred out of position, it causes irritation. The irritation will turn into inflammation. And I think that's what they're experiencing. So what I do is I put that first cervical vertebrae back in its proper position, the irritation comes off, the inflammation comes down, and no episode. Okay? So I'm going to briefly talk about the start and the progression of Menieres, because with my experience, it starts out as tinnitus. And tinnitus, if the vertebrae is not put back properly, it will start with tinnitus, and then it will go into vertigo, and then eventually it will turn into hearing loss. And so in a brief moment, we're going to talk with a couple of patients about their story, their struggle, and also their treatment here. So please stay tuned.